Assalamualaikum warahmatullahi wabarakatuh. My name is Safita Susarani. The aim of this video is to accomplish the extended reading assignment, and the context I will explain is about the Javanese culture in maternal postpartum care. The background of this study is that these practices is contradictory with first the health condition of the mother, and the second is due to religion view. Such practices including first the food and drink restriction, and the second is some practices like no napping in some certain position of the body, and the third is certain ceremony that includes offerings. The examples of practices that contradictory with the religions is such as providing sharp objects such as scissors, pins, that have to be provided after the birth. And the second is the ceremonial like mandem ari-ari, or the burial of the placenta, or propohan or selamatan in Javanese, that includes offering and cutting hair and other material. And also this video also explain about how the people carry or proceed the ceremony, how the reason behind why they doing it, and include the respondent education background and also the financial background. Mostly the participant of this study is female or mothers in the age above 20 and below 40. There are some that under 20 and not many, under 10 people is above 40. In Indonesia, tradition is carried between generation to generation. They carry it into most aspects of life, as we all know that the first belief that Indonesian hold is Hinduism. So and nowadays and later on the religion, the beliefs most of Indonesian are Islam. So the both religion influences the way people live today. The prominent practice such as buy sharp objects like scissors and pins is contradictory with the religion. They also do the half-sitting sleep position with straight legs, this to avoid swollen on the limbs and ankles. Drink herbal medicine, consume meat, fish and eggs, consume only certain food. There are some kind of food that need to be avoided strictly during the healing process. And some restaurants also receive social support. When once a mother delivers a baby, the neighbors will come bringing some supplies for the babies. Sometimes it could be the baby needs, such as soap or something like that, or even clothes. It's very good. The tradition is very good. would be a problem if we continue to proceed it, since Indonesia is very family oriented society, and they do some self-care like the whole body massage after giving birth. Japanese Japanese ethnic has their own perceptions about healing process. So the aim of these practices is to achieve less pain, less odor of the blood discharge or even the breast milk. So those food and drink restriction is to aim to that part. Food restriction, also known as food taboos, mean that mothers always avoid some particular kinds of food, such as spinach. So the newly delivered mother is not allowed to eat spinach to avoid some excessive bleeding. It is believed that it will avoid excessive bleeding, and to aim a faster healing in the wound. The purpose of food taboos also the birth canal wounds will be healed faster. Avoid foul odor on the blood discharge. Avoid itchiness. Avoid bleeding, and the breast milk will run smoothly and the smell is not fishy. The food restriction is carried out such as eggs, fish, seafood, eel, meat, catfish, sprout, cabbage, raw jackfruit, beans, ambon banana. The daily diet mainly rice, tofu, tempeh, and some vegetables, boiled vegetables. The fact is that these practices cause the mother having a lack nutrient that will affect the breast milk supplies, and also interfere healing process the healing process of the wounded area. Study says that mothers who do the breastfeeding needs up to 500 calories per day addition compared to those who doesn't do the breast milk. And in total, a breast milk mother will need total 2040 and 2400 calories per day to carry daily activities too. And according to the recommended balanced nutrition guidelines, the meal is divided into 6 times, 3 main course and then 3 snacking time. The conclusion is mother does not have the courage to disobey the rules that the old generation encouraged them to proceed, such as food and drink restriction, and also certain position that to avoid some changes in the bones in the future. And well, the tradition is not only the cause of the malnutrition, the lack of nutrition of these mothers, it's also the financial problem. Those who has low ability to provide food, of course, will have a more prone to malnutrition. There is fact that newly delivered mothers is allowed to drink 1 to 2 glasses only per day. It is believed that so the wound in perineal area will be healed sooner, especially for those who have stitches. But it is not true. It will affect the breast milk supply, and the healing process will be slower too. And about the food restriction, that is the solution. Dietitian suggested that it is best to replace the food that have to be avoided with other kind of food that have about the same nutrient that is needed by the mother. Other fact is about the itchiness on the stitches on the perineal area. It is believed that some certain kind of food cause the itchiness sensation. According to the studies, it is not true. It has something to do with the personal hygiene. Mothers who just delivered the baby also have to drink certain kind of drinks. Medicine herb. It is believed that it will boost the hormone called certain hormone that can boost the breast milk supply. It is true. So drinking herbs is beneficial to mothers. Now about the ceremonial that include postpartum mother is prokohan. Prokohan, also known as selamatan in Javanese. It is usually the family usually provides offerings like flowers or also food, and they will invite the neighbors to pray together. It is also a symbolize that showing gratitude to God that the deliverer is safe, the baby is healthy. Also it means that from the word Arabic word that means barakah, mean expecting blessed from Allah.